Hello and welcome to all of our viewers, our listeners out there, and a very warm welcome to our panel guests here at Holden Fitzgerald Insights Live on-air event. Today's discussion will be on mitigating risk, effective risk management strategies, and global public health. I'm your host, Enoch Kimmel. I'm the Chief Development Officer here at Holden Fitzgerald. Today we're fortunate to have a panel of 4 experts. There's a few that wouldn't be able to make it today, but we'll just go through the list. Who will be sharing their insights on this relevant and important topic. Our panelists, Fidel Uwasu, he's an International Relations and Security Analyst. Dr. Dennis, he's International Public Health Expert. Dr. Zolalwa, she is a Project Manager in Healthcare Space. Ken Hackshaw, he's a Risk Management Consultant and President of the Caribbean Risk Management Academy. We have Robert, he's a Project Lead Advisor in Africa Risk Capacity, and Dr. Ryan Paul, he's the CEO here at Holden Fitzgerald. So I'm just going to start by asking each of you, the panelists, to briefly introduce yourselves and then begin the discussion topics. Again, thank you all for coming in and viewing as our audience, and let's get started.
I'm going to jump in really quick and apologize to the audience. There were 3 cancellations. Dr. Franklin, Dr. Dennis, and Dr. Fidel had something come up last minute. So we do appreciate you understanding that, and thank you for continuing to tune in. So with that, Robert, if you could please start us off by introducing yourself and talking about a little bit about where you're at, where you come from, and what you do.
Thank you very much, Ryan, and your team for this invitation. So my name is Robert Kwame Ajakun. I work for the Africa Risk Capacity based in South Africa. So basically the work that we do here is on risk and helping countries to work against risk like floods, tropical cyclones, and then drought, and then also disease outbreaks and epidemics. It's a pleasure to be here, and I look forward to this discussion. Thank you.
Good morning, Ken.
Good morning and good day to the listeners. So I'm Ken Hackshaw. First of all, I want to thank Enoch, Ryan, and the rest of the Holden Fitzgerald team for putting this soiree together. I think it's long overdue and much in need. The convergence or the integrating of risk management into modern day risk management into the global public health. So I'm Ken Hackshaw. I'm a risk management consultant. I'm also the founder and president of the Caribbean Risk Management Academy. We do a lot of interventions and teaching and educating and increasing the risk intelligence of the Caribbean population or the global population wherever we have been asked to engage. And I look forward to having this conversation, and hopefully the listening audience will leave a bit more risk intelligent than when they joined us.
Thanks so much, Ken. So I am Dr. Ryan Paul. Thank you again so much for tuning in to the September panel of Holden Fitzgerald Global Insights. This panel is going to be a little bit different because we did lose 3 or 4 of our panelists to some other engagements and a couple other things that really just had more importance, right? Which taking care of family, taking care of other work is more important. And so we want to support that. So thank you to Robert and Ken and Enoch for joining me today. Again, I am the CEO in Holden Fitzgerald. I am an infectious disease and pharmaceutical epidemiologist by education, but I spent most of my life as a social entrepreneur. I think I will say both with what Ken has just said, as well as what Robert is going to jump into as it relates to talking in general about risk models and what ARC is doing in the African continent today, is that it is long overdue that we have a conversation about risk management, and as Ken will talk later on, enterprise risk management, and how we faithfully, intelligently, and effectively deploy risk management in global public health. A lot of times when we talk about risk in global health, we miss a lot about what risk management actually looks like as it relates to actually insuring for it, creating financial models around it, and then mitigating for those risks to protect those financial models by being both prepared and preventing certain risks that can be prevented. So with that said, I will leave it at that as an introduction and turn it back over to Robert. I know that we have a kind of a framework for the conversation that we're going to have today. So I'm going to let Robert, lead from some of that script, and then we're just going to really keep this informal today. Let's just have kind of an open conversation as good friends about what this looks like, what the risks, what the challenges are, what security looks like, not only in the African continent, but in the Caribbean and in other parts of the world, and how the work we're doing can really improve the situation as it relates to both risk and security, primarily in global and public health. So thank you so much, guys.
Sure.
Right. Thank you, Ryan, again. And it's a pleasure to be here. So I think first, if we're going to talk about public health risks and threats, we just need to begin to phrase what it is that we're dealing with. So I was speaking to someone a couple of days ago, and I said, we live in, I would say, a time where things have changed. I mean, COVID is something that none of us have experienced. The last time the world experienced something of this sort was about 100 thereabouts years ago. So this is the world that we live in, where health risks can shut the whole world down and in the space of a month. That's one. We are also in a world where we're beginning to see climate change and health intersect. If you're in Florida, you would have heard of some malaria cases in the south of the United States. You will hear about dengue in bits of Africa. So the world is changing, and the risks that we are facing now are not going to be the risk that we will have tomorrow because of the way the world is evolving very quickly. So what we do in the African risk capacity is to support countries to mitigate against risks that are known while we plan for the future. So we have a product on drought that has been in existence for about 12 years. And the new product that we just put out is on disease outbreaks and epidemics. And it looks at 4 diseases, Ebola, Marburg, meningitis, and then Lassa fever is something that we're still working on. The whole framework is that countries need to be prepared. The lesson that we've had from COVID to Ebola to others is simply that we react as a world. We wait until something happens, and then we jump and react. And then when the problem is no more, we stop and we don't plan for the future. What ACT seeks to do is to help countries to prepare and prepare, and then also respond. And how do you do that? By understanding the risk that you have, so epidemiological studies that will give you a sense of the pathogens that affect the country and in what form. And then you can also then look at risk modeling, where you will be able to have different scenarios of small, medium, large, urban, rural. So differences in scenarios based on which you can plan the contingency. And then what we provide is sovereign insurance. So here we have an insurance product that countries can put a risk on and say, look, we would like to pay a premium of X amount of money. And if we have Ebola, Marburg, or meningitis cases of a certain threshold, then the insurance will pay in to support that. So as introduction, this really is an innovative way of supporting countries, because what you want is for countries to have immediate response funding, which is something that comes in within the first week, first couple of days, maximum 2 weeks, so that they can meet the risk. So this is just way of introduction, and I think as the conversation progresses, I will turn into other areas. Thank you, Ryan.
Ryan, you're muted.
Could you hear me, Brian?
All right, we're back. Sorry about that. Yeah, I am in the Blue Ridge Mountains right now, so it's spotty, but I did have mute on. Fidel, my man, thank you for joining us. I appreciate it. I wanted to put a pin in it and give Fidel an opportunity to introduce himself, but it looks like we're losing him. So as soon as we get him back, we will give him an opportunity to introduce himself and talk a little bit about his work. But with that said, Ken, I'd love for you to respond as it relates to what Robert just said, and talk a little bit about your worldview as it relates to risk management and where you see risk management going in the context of global public health.
Yeah. Okay. And Robert, thanks for that. As I said earlier, those conversations need to be had. And so my view from a lived experience perspective, and from what I love to call horizon scanning, yesterday's risk management will not suffice for today's public health challenges. It just wouldn't work. And I'm oftentimes reminded of what Einstein said, and it goes like this, a quote: thinking that has brought us this far has created some problems this thinking cannot solve. And as we go through the days that we live now and the days to come, that quote should remind us that we cannot solve today's problems using yesterday's processes or yesterday's thinking. And so the role of risk management in healthcare has evolved, but it needs further evolution, and I dare say probably a bit of revolution. And the revolution part of it is getting the decision makers to start thinking differently about risks. And if we stay with the African continent, and the theme here is Africa 2023 to some extent, but it also applies to the Caribbean and other continents. But if we put on our blinkers and focus specifically on the African continent, there's so many unknowns. Yeah. And my concern as it relates to public health, and I love my medical practitioners, but risk management today going forward has to be more than just clinical risk management or the administration of public health. It has to be more than the known risks that is with us and that we expect to come, like the reemergence of old diseases once thought extinct, and enterprise risk management, which is what I would refer to as modern day risk management for the most part, tends to connect the dots. So if we have to build an org chart around what enterprise risk management will look like in global health, public health spaces, it will encompass all of these disparate risk disciplines around public health, whether it's clinical risks, health and safety, the known medical challenges, the pharmaceutical side, the epidemiology side, all could fall under this overarching umbrella of enterprise risk management. Because that which is not identified, that risk that is not identified, monitored, I'll use a medical term here, surveilled, reported, and mitigated will hurt us, and we are seeing some of that. So yes, we could be singly focused on the medical clinical aspect of that, but there's so many bad things and opportunities that surround the practice of global health, that if we don't focus on or give attention to those things, the practicing of medicine and the pharmaceutical delivery will be impacted. A very good example is supply chain. You have to move pharmaceuticals from one spot to the other, especially in conflict areas. And I know Ryan and the gentleman who just joined us will speak more about that. It includes, okay, how does the actual conflict impact on the delivery of public health? What's the role of technology in treating with the delivery of